Today, we're going to talk about a massive global health goal, one that, frankly, the world is on track to miss in a big way. But here's the thing. We're also going to explore a completely new way of thinking that could change how we fight a condition that affects hundreds of millions of people.
So let's start with this number, 52.1 million. Now, that's not the population of a country, that's the number of years people lived with a disability because of anemia in 2021 alone. It is the single leading cause of impairment on the entire planet. Think about that for a second. The impact is just staggering.
So, what are we even talking about when we say anemia? Well, to put it simply, it's a condition where your blood just doesn't have enough healthy red blood cells or hemoglobin. You can think of hemoglobin as the oxygen delivery service for your entire body. When that service is understaffed, your body can't get the oxygen it needs to work right, which leads to things like fatigue, weakness, and some really serious health problems.
And the scale of this problem, especially for women, is just immense. Globally, 30% of all women of childbearing age are anemic. That jumps to 37% for pregnant women. We're talking about nearly 1 out of every 3 women between the ages of 15 and 49, a group that is absolutely vital to the health and stability of families and communities all over the world.
And here's something that's really important to understand. This isn't hitting everyone the same way. The burden of anemia disproportionately strikes the most vulnerable people. Folks in low and middle income countries, people living out in rural areas, those in poorer households, and women who haven't had a formal education. It's a condition that basically stacks the deck against people who are already struggling. So, we've got this massive, unequal health crisis on our hands. The global community saw it and they set a big goal to fight it. But as it turns out, that goal is now completely and honestly worrisomely out of reach. This timeline, it really tells a story of a huge missed opportunity. Back in 2014, the World Health Organization set a really clear target. Let's cut the prevalence of anemia in half by 2025. Well, here we are, right on the doorstep of 2025, and we're not even close. In fact, new studies are projecting that not a single country on Earth will hit that target, even if we push the deadline all the way out to 2050. And look, this isn't just a minor setback. A huge 2024 study in The Lancet, one of the top medical journals in the world, put it bluntly. They forecast that there will be, and I'm quoting here, no country to meet the targets for anemia in 2030 and 2050. This is a giant red flag that the global strategy we've been using has pretty much failed. So let's just pause on that for a second. The crucial takeaway here is simple. What the world has been doing for the last decade just hasn't worked. The policies, the funding, the big strategies, they just haven't delivered. And this brings us to the real core question of our explainer today. If you're a leader in a country that's bearing the heaviest burden of this crisis, what can you actually do differently to make real progress? Well, the research we're looking at today proposes a fundamental shift in thinking. It's a new 3-step plan that turns away from those big, abstract global targets and instead focuses on something much more powerful: concrete local action. Okay, so here's the proposed path. First, you've got to build the political will to make this a real priority, with real policy and real funding. Second, you use local data to design programs that communities will actually use. And third, and this is a big one, you completely rethink how you measure what success even looks like. And you know, this isn't just a theory. This framework is actually inspired by a real-world program that has seen success, the WIC program in the United States. By providing nutritious food, healthcare referrals, and education, it really proves that a focused, well-supported, and comprehensive approach can get results. So, what does a local program actually look like in practice? It's way more than just handing out iron supplements and calling it a day. It's a whole-person approach. It includes providing nutritious food, offering crucial education, supporting breastfeeding, and, this is so important, creating health referral systems to tackle the other non-dietary causes of anemia, like hemoglobin disorders or neglected tropical diseases. This entire model is about more than just a new to-do list. It really represents a fundamental change in mindset. It's about rethinking the entire path forward in this global fight. And this right here, this gets to the absolute heart of the change. The old approach was obsessed with one big abstract number, the national prevalence rate. But the new approach asks a much smarter, much more powerful question. Of the women who are eligible for our program, how many are actually showing up? How many are actually receiving the benefits we're offering? Okay, so why does that little shift matter so much? Because focusing on participation gives policymakers real actionable data. It tells you if you're actually reaching those vulnerable, hard to reach populations we talked about at the beginning. It lets you monitor your progress in real time, tweak your strategy, and prove that what you're doing is making a real difference on the ground. Which leaves us with a final provocative thought. For years, the world has tried to solve anemia with a top down, one size fits all global target. But after a decade of failure, maybe it's time to ask, is the key to finally solving this global problem not found in big global mandates, but in empowering effective, measurable local solutions?